online, and just to advise that you are welcome to use mobile devices as long as they're in the airplane mode and all devices are muted. This also includes members' tablet devices, and they can connect to the Assembly Wi-Fi. Just as a reminder to members that they are obliged to declare any financial or other relevant interests which might reasonably be thought by others to influence their approach to the matter under consideration. Any members who have interest to declare in relation to today's business should do so now for the record. Unless somebody indicates to me, we'll proceed. Can I seek agreement with the member? Yes, Colin? Yes?
Just to declare my interest as having worked previously as a social worker and also being on a leave of absence with one of the trusts in relation to that role. So,
okay, thank you for that, Colin. Just to seek agreement of members for the oral evidence session to be reported by Hansard. Agreed? Apologies. I have apologies from Jerry Carroll, Karen Cullen, Jonathan Buckley and Emma Rogan. Okay. No other apologies. Can I welcome then the Deputy Chairperson, Colin Gildernew, and the other members who are joining by Starleaf, and also Peter, who is with me here in the room, and also to the staff from Justice and also from Health. And can I thank Colin for kindly agreeing for me to chair this. It's very good of him to allow that to happen. I've been quite happy for him to chair it, but so you're all welcome. Members from the Justice Committee are also joining us by Starleaf, and that is Linda, Rachel, Sinead is to join us, Gemma and Doug, and hopefully Robin to join us soon. Members of the Health Committee by Starleaf are Gordon Lyons, Orla Flynn, Cara Hunter, Alan Chambers, Paula Bradshaw and Jerry Carroll, who we have an apology from. Could I invite the clerk to advise members if any have indicated that they've delegated authority to vote on the behalf of another member according to Standing Order 115?
Thank you, Chairman. Under Standing Order 1156, Emma Rogan has delegated her vote to the Deputy Chairperson of the Justice Committee, Linda Dillon, and Jonathan Buckley has delegated his vote to the Deputy Chairperson of the Health Committee, Gordon Lyons.
Thank you. That brings us to Agenda Item 2, the development of a joint secure care and justice campus for children on the Woodlands Lakewood site, oral evidence. And can I refer members to the relevant papers, which are pages 5 to 148 of the meeting pack that was circulated via the Assembly system on Monday and can also be found within the members' committee pack folders. The purpose of this joint committee meeting for Justice and Health is to take oral evidence on the proposals for a joint care and justice campus for children and young people at the Woodlands and Lakewood sites following the publication of the consultation analysis report, which was published by the Ministers of Justice and Health on the 16th of June. Procedures for the joint committee and the arrangements for this meeting are set out in the clerk's memo at pages 2 to 4 of the meeting pack. And just to advise that the officials from the Department of Justice and the Department of Health will join the meeting via Starleaf. And can I at this stage welcome, and I see them waiting patiently for us, Stephen Martin, Chief Executive of the Youth Justice Agency at the Department of Justice, Ellis McDaniel, Director of Child Care and Family Policy, Department of Health, and Joanne O'Hara, Joint Programme Team at the Department of Health, to the meeting. And can I just advise them that the session will be reported by Hansard and the transcript will be published on the committee website. So I think it's maybe Stephen, is it you're not going first? No?
No, Eilish is going to.
Eilish, right. Eilish, you're very welcome. You're all very welcome to the committee, and we'll just ask Eilish McDaniel to outline the key issues arising from the consultation. Thank you.
Okay, thank you, Chair, and good afternoon, members. My thanks to the committee for this opportunity to provide you with an update on the proposals for the establishment of a regional joint care and justice campus. As members are aware, restricting the liberty of a child or young person is one of the most serious interventions that can be made, making it essential that it's done only when it's absolutely necessary for the shortest time possible, and that it's subject to the strictest controls possible. It's been made very clear from the Department of Justice Scoping study, which concluded in 2016, and the review of regional facilities for children and young people, which was published in 2018, that we need to reform how we deliver juvenile justice and secure care services in Northern Ireland to, among other things, prevent some children and young people who are among the most vulnerable in Northern Ireland from moving from one service to another on a revolving door basis. By establishing a regional care and justice campus, we have dual aims. Firstly, to prevent some young people being deprived of their liberty in the first place, and secondly, for those who are, to provide them with a high level of support capable of meeting their immediate and their future needs. It's envisaged that the Regional Care and Justice Campus will comprise a secure care centre and multi-agency satellite provision, including a step-down facility and community-based provision. The secure element of the Care and Justice Campus will involve repurposing of the existing Lakewood Secure Care Centre and Woodlands Juvenile Justice Centre sites, and is intended to provide a safe, secure and therapeutic environment focused on achieving stability and preparing for a return to the community in the shortest possible time frame. Children will receive an individually tailored support package in response to their assessed needs. A multidisciplinary therapeutic approach will be adopted to support planning and delivery of therapeutic interventions to children and young people, as well as the provision of advice, training and support to staff. It's intended that each child's plan will support reintegration to the community and prevent re-entry to secure care. This will require coordination of services in the community that complement the care in the secure centre to ensure that transition back to the community is as seamless as possible. It's essential that children feel supported and able to participate actively in decisions made about them, and the proposals for the campus seek to ensure that the voice of the child is at the centre of planning decisions. As recommended by the review, the proposals include the establishment of a regional multi-agency panel, which will have a decision-making role in approving or otherwise a HSE trust proposal to make an application to the court seeking a secure care order, and an associated monitoring role. This panel will be established in such a way as to enable the active participation of children and their advocates in decision making. The care of children within the campus will be supported by the new Northern Ireland Framework for Integrated Therapeutic Care, and it is intended that this framework will promote a shared understanding of the impacts of trauma and support children's recovery through relationally focused care, the identification of specific intervention and support needs, and the implementation of a team around the child approach. The active participation of children and their families in all aspects of care decision making is an essential element of this proposed new framework. The proposals to provide a new service model for a new care and justice campus issued for a 12-week public consultation on the 21st of October. A child-friendly version of the consultation document and an animation explaining the campus proposals were produced, and they were made available via social media. Due to restrictions necessary as a result of the pandemic, it was not possible to hold public events to facilitate engagement as part of consultation. However, virtual engagement sessions were arranged for staff and their representatives, and for other stakeholders as requested. There has been full engagement with the stakeholder reference group, made up of children's rights and advocacy organisations and voluntary sector children's services provider organisations before, during and since the consultation ended. 4 advocacy organisations used the child-friendly consultation materials as a basis for undertaking bespoke engagement sessions with children and young people. In addition to the stakeholder events, the Youth Justice Agency also contributed feedback from engagement with children and young people in Woodlands. Both departments have kept the Commissioner for Children and Young People updated since the programme to establish the campus commenced. We've been grateful for her contributions, and as far as possible, we've sought to address the issues that either she or her office have. There were 73 consultation responses from a broad range of stakeholders, including individuals, voluntary and community sector organisations, professional bodies and public statutory bodies. Responses to the consultation document were broadly positive, with support for the vast majority of proposals. However, within that positive feedback, there were important points identifying a number of issues in relation to the proposals which have merited further consideration. One such issue identified was around the use of the Secure Care Centre as a place of safety under police and criminal evidence legislation PACE. And while the majority, around 72% of respondents, agreed with this, that the Secure Care Centre should continue to be used as a place of safety for children following arrest, if required, a small number of respondents have stated that the Secure Care Centre should not admit any children and young people under PACE, and most respondents were supportive of alternative accommodation options being developed. We are clear that the use of the Secure Care Centre as a place of safety must be kept to an absolute minimum, and will move to identify and develop suitable alternative accommodation options, working with all relevant stakeholders to do so. This will be more of a challenge as a result of the pandemic, with the increase in the number of children who have been taken into care. The consultation exercise also highlighted concerns, including from children and young people themselves, surrounding the integration of those children and young people who require a secure placement for welfare reasons, and those who are involved in offending behaviour. The safety and security of children and young people and the staff who care for them must be at the heart of the Secure Care Centre. Staff who work in Woodlands JJC and in Lakewood currently care for children and young people with varying complex needs on a day-to-day basis, and they make risk and needs-based decisions aimed at keeping all of the children in their care safe. But the review of regional facilities for children and young people made it clear that the needs of these children and young people were not being well served by having two separate facilities, which saw many of the same children experiencing frequent moves between them. We are committed to developing a needs-led and risk-managed model of practice in the Secure Care Centre. And the purpose of this approach is to provide safety and stability for all children and young people placed in the centre, and to begin to address emotional, behavioural and developmental issues through a trauma-informed, integrated, therapeutic and individualised approach. The consultation also highlighted concerns about the potential for the Secure Care Centre to be used inappropriately for children with mental health difficulties due to a lack of alternative options, and that this could be exacerbated with the full commencement of mental capacity legislation. The Department of Health is working with the Royal College of Psychiatrists and the Children's Law Centre to assess the potential impact of the mental capacity legislation. A thorough review of existing legislation will be carried out as part of the work to establish the Secure Care Centre. In addition, further detail on the package of education and support available to children and young people in the centre will facilitate an assessment of the extent to which the new centre will comply with human rights obligations. These are some of the key issues which have arisen during consultation. The full report summarising the responses to the consultation and setting out both departments' joint response and plans for next steps has been published on the departmental websites, and both committees have received notification of this, and you referred to that, Chair, in your opening remarks. The next stage will focus on finalising a range of proposals to enable us to move to implementation of the campus. This will involve the development of detailed plans to include the governance and accountability arrangements, the range of education, training, health and therapeutic services that will be available in the Secure Care Centre, the standards that will govern the operation of the centre, and the staffing arrangements for the new centre. This is a true partnership project, not only between the Departments of Health and Justice, it's also being supported by the Departments of Education, for the Economy and Communities. In terms of delivery, it will involve multiple agencies and professionals working together, some of them in the Secure Care Centre, but also in the community. It will also involve partnership with children and young people and their parents, those who spend some time in the Secure Care Centre, and as we continue to develop the detail on the proposals, engagement with children and young people will continue to form an important part of that process, and the programme team will be developing structures to allow that engagement to happen. We fully recognise that the establishment of the campus requires a significant change in how we think and how we do things. However, we consider that we are starting from a strong base and believe that by joining the forces of very dedicated and professional teams of staff, we have the capability to deliver so much more and, importantly, improved outcomes for children and young people in need of secure care. Chair, that's a brief summary of what we've set out to achieve by way of the establishment of a joint care and justice campus. Some of the issues that have arisen through consultation, and it's also an acknowledgement that there is much more work to be done to implement what departments have set out to achieve. And we're now happy to take questions from members. Thank you very much.
Thank you, Elise. Thank you very much for that. And can I just say to members, I will endeavour to get to you in an ordered way so that we have the members of Justice and Health are able to ask whatever questions. So thank you to those members who already have indicated, and if those who want to ask questions haven't yet indicated, please do so that it will keep me in check. Ellis, just one question I want to open up with, and I suppose next week we will have the Children and Young People's Commissioner before the committee, and obviously she has raised a number of concerns. Do you believe that those concerns, and it would certainly be our intention from the Justice Committee, that following on from that presentation, any of the issues that she raises, that we would consult with yourselves in terms of response? But do you believe that those concerns, which are, I suppose, are around what you mentioned, the strict controls, the concerns that have been raised as the alternative to the Secure Care Centre for PACE, all of that, and I suppose the careful assessment of risk, which seems to be one of the dominant themes that occurs in relation to this. Do you believe that those can be addressed so that this facility is given the best possible opportunity to succeed?
Thanks, Chair. We've worked very closely, and I think I've made that clear in the opening remarks. We've worked very closely with the Commissioner throughout the process of developing the proposals for the campus, and she's raised a number of concerns with us. You've referred to some of them. In terms of confidence about whether or not we can sufficiently address those concerns, I think it's fair to say that we are reasonably confident that that can be done. I think the biggest challenge will be in providing alternative options to accommodate children under PACE by way of an alternative place of safety. I've made it clear in the opening remarks that that has become more of a challenge for us because of the pandemic. One of the things that we were proposing potentially to do was to use of some of the wider residential children's estate, our children's homes, to accommodate children under PACE. We've now got more than around 200 additional children taken into care between the start of the pandemic and the end of this month. So you can imagine that that does create further challenges for us. But in summary, can we sufficiently address the Commissioner's concerns? I think in time, absolutely, we will be able to do that.
And just on that point about the numbers, Elise, you obviously would be concerned that there has been a very marked increase in the number of young people who have had to be placed into care as a result or during the lockdown period, which hopefully is not as it was over the last 18 months. But clearly, I would pick up from what you're saying that the numbers have dramatically increased.
It has been a sharp increase and one that we are paying very careful attention to. So the proposal is to put a paper to the Regional Management Board within the Department of Health, the board that is actually overseeing implementation of recovery within the Department of Health coming out of the pandemic. And that paper highlights the increase that we have had and sets out a range of proposals, steps that we need to take to look at that and other challenges within children's services more generally.
Just briefly then to Stephen, and then I want to go to the chair of the Health Committee. But Stephen, as the Chief Executive of the Youth Justice Agency, how important is it that there is a close working relationship with all the relevant component parts to ensure that this project is successful?
It's absolutely vital, Chair. I think one of the things that this programme has helped to do is to build and cement relationships, particularly between health and social care and justice. And one of the other issues that Eilish touched on in her opening remarks that will make this campus work well are the community services that will be needed to support it, and they will do two things. One is try and prevent entry into secure care by resolving the issues that young people face in the community, and secondly, whenever young people leave the secure care centre, that they're supported back into the community in an integrated way. And we've been able to make some strides already around some of that. So just to give you one example, Chair, mental health is a big issue of concern for many of the young people that the Youth Justice Agency work with. And we've developed a partnership on a pilot basis with the Southern Health and Social Care Trust, where we co-fund a child and adolescent mental health worker who is located in the Youth Justice Agency, and that is making massive improvements in terms of the services that we're able to deliver in our southern area, and we're looking to roll that out. So I think it's, to answer your question, we're both sides, both justice and health and social care, as well as education, we're all bringing our strengths to the table and trying to work in a combined way to improve outcomes.
Thank you, Stephen. And now I'm going to go to members, and I'll try and do this as best as I can between the two committees. Colin, the chair of the Health Committee.
Thank you, Chair. And if I may, two brief questions just on that. The first one of which is around, and again, just to indicate that I have worked as a social worker previously myself, but also have family members who have worked in some of the facilities that have been mentioned in the presentation. But from my experience of working with children and young people in relation to this, it's very clear that very many of them, both within the health and social care setting and within justice, are dealing with a range of issues which in a way sort of went against them from the start, and they're all extremely vulnerable and have been let down by us in many ways, the adults and society, and that's why many of them are in these positions. But in relation to how you will integrate vulnerable children into this new setting, and there is clearly some risks in the initial period, could there be a risk of isolation rather than integration, and how will you monitor and measure to ensure that no one is falling through the cracks in that system and that you are levelling up for all of the children and young people involved? Thank you.
So in terms of integration, Deputy Chair, all children will be admitted on the basis of assessed need and also on the basis of assessed risk. And that is current practice within both centres at the minute. We do admit, and you're acknowledging it, I think, that we do already admit children with a range of needs, ranging from relatively low-level needs right the way through to very complex needs. So we do it at the minute, and we do it, I think, reasonably well. I think there are other measures that we will introduce as part of the implementation of this campus. So, for example, the introduction of the new framework for integrated therapeutic care, which I think will deliver benefits for all of the children and young people in the centre. Certainly, isolating individual children is something that we will be absolutely mindful of and will guard against. And I think the implementation of the therapeutic framework will certainly assist with that. It will introduce an individualised integrated therapeutic planning model where we'll set out the therapeutic goals for individual children, put strategies in place to deal with those therapeutic goals, have effective planning mechanisms in place, subject those plans to regular review. There will also be, we've referred in the opening remarks to the new multi-agency panel, which currently operates on a pilot basis or on a shadow basis. It considers admissions to secure care currently, but under the new arrangements, it will also have a monitoring role. So it will consider planning arrangements for individual children. Are plans in place? Are they being reviewed? Are they sufficiently meeting the needs of individual children? Is discharge planning, etc., being considered at the earliest of stages? So I think there are a number of mechanisms which I think combined guard against your fears of isolation within the campus because of that combination of children from both a welfare background and a justice background.
Thank you. And could I ask a second question then, Chair?
Yes, go ahead, Colin.
Yeah. And thank you for the presentation, Eilish, and for your engagement with the Health Committee in the past in relation to this issue as well. And I do note the fact that there's been co-production and consultation with young people and children in relation to this. And actually, you brought me to my second question at the end of your answer there. Do you see that multidisciplinary team monitoring process? Could you commit that children and young people's voices would be included and that they themselves would be included in that? Because we have seen in the Health Committee where young people are very, very firstly aware of what it is that they need and benefit and well able to articulate that. So would it be possible that rather than just having a solely professionally driven monitoring system, that young people and children's voices would be included in that so that we can continue to add value going forward? Thank you.
Yes, I think is the short answer to your question. I referred to the panel operating on a pilot basis at the minute. As part of that panel arrangement, and you're right, it's in the main made up of statutory agencies across health, justice, social care and education. But there is also advocacy representation on the panel. So VOIPIC will support children and young people through that process. My understanding is that of the cases that have come before the pilot panel, around 80% of children have sought to be represented at panel, and nearly half of them, around 46% of them, have actually participated in the panel arrangement. So I think we're doing it already, and what we will need to do then is to build upon that through the implementation of the new campus arrangements. And the framework for integrated therapeutic care that I referred to as part of the development and also the implementation of that framework, there has been or will be what has been described to me as a participatory advisory group established that will involve children and young people and their parents to give them a voice in terms of how the model develops and also how it's implemented.
Thank you.
Thank you. Thank you, Chair.
Thank you, Colin. Now, Linda, the Vice Chair of the Justice Committee.
Thank you, Chair, and thank you to the officials for coming here and for everybody for facilitating today's meeting, the clerks of the committees and the committee chairs. Appreciate it. I suppose firstly just to speak to something that Colin said at the beginning around us all bearing some responsibility. I do think it probably is a sad reflection on us all that we know that all of these young people that we're talking about, or at least many of them, have challenges, whether it be through the education process, their own home life, and been let down by health and social care at some point, that had intervention been made at the right point, they would never reach the point of needing this. However, we are where we are, and I do think that even in terms of all those things, we are probably in a much better place than we were 10 years ago, and even less than that. So I do really welcome the approach that's been taken by both Justice and Health in relation to this particular issue. So just to make that point, Chair. I want to go back to a point that was made earlier. A number of young people, or a number of respondents rather, drew attention to the issue of young people being remanded because they can't perfect bail, and the need for suitable alternative accommodation options to be developed for these young people. And you've already responded to that, and I appreciate that. But and this is probably more to our justice officials, there was clauses within the proposed justice bill around changes, that would have resolved some of the issues around bail for children. And I'm just wondering, are we going to be able to do something in relation to that, given that those clauses have been taken out of the justice bill? And how will we address that? Because that could have resolved some of the problems. And if you want to go to that first before I continue on with a few other questions, I'm happy to allow you in.
Okay, Linda, thanks. I'm in my 7th week in this role, so I won't pretend I'm any massive expert. But yes, it is really unfortunate that those clauses aren't going forward as part of the Justice Bill. I suppose there are two things that we can do. One is a very practical thing. So, as Eilish said, what other arrangements can we put in place for both PACE and remand, so children don't need to go into the secure care centre? And there's some really interesting pieces of work that my team and some of the trusts are doing around what some of those alternatives might be. So we're looking at, for example, bail fostering placements where there might be specialist foster carers who can take young people on bail if there's no alternative. So just because the bill, those clauses aren't going forward in the bill, doesn't mean that there aren't things that we can do, and we will do those. I suppose the other thing is that we have for a little while now been looking at developing what might become a children's bill in the next mandate, and there are a number of issues, including the issues that are no longer in the Justice Bill, that we would be looking to bring forward. So we're hoping to address it in those two ways.
Appreciate that, Stephen. And my next question has already been answered, so I'm not going to ask you to answer the same question twice. Just the majority of respondents said legislation will be required to underpin the roles and responsibilities of the multi-agency panel alongside the legislative programme discussed in Section 8. Which department will lead on the legislation, and when will you be in a position to develop the legislation?
Okay, so I'll take that, Linda. Some of it will depend on final decisions about the governance arrangements of the Secure Care Centre. And the decision about who can lead or who needs to lead in bringing forward the legislation still needs to be made, and there are a number of unknowns at the minute that prevent us from being very specific at this stage. We had hoped to be able to introduce legislation in the current mandate, but the programme is now around 9 months behind schedule, and that was a direct consequence of the pandemic. So we had some of the programme staff who were actually moved on to other COVID related work. So it will be, Linda, the next mandate before we can actually introduce new legislation, and obviously we will aim to do that just as quickly and as early as possible within the new mandate.
I appreciate that, and I appreciate the issues in relation to it. I would ask that as soon as we know who's going to be the lead on it, that we're given that information. I think it's important. It's important for us as committees to be able to I suppose, around accountability, and even for the sectors and those who advocate for these young people out there to be able to follow that and have that accountability mechanism as well. So I just think it is important. So if we can be given that information as soon, I appreciate you don't have it yet, but as soon as we are in a position to say who will be the lead. And I suppose I'd be keen that there is somebody in the lead rather than we say this is justice and health, because I can speak from much more minor issues where you have a patch of road where there's an argument if it's housing executive or it's roads, that can go on for a very long period of time. This is massive. We can't allow that there isn't somebody in the lead that can be held accountable, and we can't have that bouncing back and forth and trying to sort of, I suppose, offload responsibility to a certain extent. Not that I'm saying that would happen, but the potential for it is always there. Then just in section 4, the needs-based approach, the report says a number of responses from individuals with experience working within a justice setting have strongly held reservations on the possible issues that could develop and impact that this could have on the secure environment. I'm just wondering if you can elaborate on that and what issues were raised and how they will be mitigated. And I mean, I do understand that obviously this, at the end of the day, it does have to be a secure environment, but I suppose it's about getting the balance and the culture right from the start. I think really is probably where.
Yeah, perhaps Linda, if I take that, I think one of the whole reasons for this programme is that there are a number of children who spend time in both Lakewood and Woodlands, but the regimes are different, so there are different expectations and different arrangements. So what the whole genesis of this programme is to try and make sure there's a more common, joined-up approach. So to be fair, there's probably some nervousness among my staff because the regime that we have in Woodlands, while it is a justice regime, is also quite moving towards a therapeutic regime, but there are fairly strong boundaries in their behaviour management standards. So they're just a bit concerned that those might in some way be removed. So, but that's not what we're talking about here. We're talking about a new set of common standards. So we need to bring people along with us, learn the best in terms of what's working on both sides, and take from the best. And we do have a really, really good, strong partnership, not just between Eilish and myself as individuals, but the two departments, and we have a joint team. So I think it's just a bit of nervousness, if I'm being honest, and there are issues that we need to work through.
Okay.
And if I could just come in behind Stephen, Linda, this has been done elsewhere, so we do have secure children's homes within England and Wales, for example, of 15 secure children's homes. I think there are 6 of them that combine welfare and justice and children, So it has been done before. It proves that it can be done, and we will want to obviously introduce our own version of it here within Northern Ireland and make the best offer possible for children and young people, regardless of how they come into the Secure Care Centre.
Okay, thank you, Chair. I have one final point, and if the panel don't have the details of this, I'm happy for them to come back to me when they do, because I'm conscious I don't want to take up time just talking for the sake of it when other members will want in. But how will the facilities recognise and cater to the distinct needs of different sexes and genders? Because obviously we know that in the past there have been problems where women have been housed in the same facilities as young men in Hyde Bank. So and obviously we also have to look to those who are transgender, non-binary, and they are often very vulnerable and marginalised group within our community, so may have much greater needs. So it's just about, I would appreciate, you may not have all the detail on that now, and I'm happy for you to come back to me in writing, but I just wanted to flag it up.
Yeah, Linda, if I could just maybe respond on that. The facilities, at least in Woodlands, are modular, so there's 6 houses, which are each separate. So girls and boys are not housed in together. They come together for education and training, but in terms of their accommodation, it's separate. So the accommodation at Woodlands lends itself very much to that, and that's one of the benefits actually of bringing the 2 sites together, because we've got a little bit more sort of space to work with. So I mean, that will be part of the planning in terms of the new campus.
I appreciate that. Thank you.
Thank you, Linda.
Sure.
Paula.
Thank you, Chair, and thank you, panel, for the update today. I've got 3 very quick questions. The first one is, how are families going to be supported to continue a strong relationship with their loved one? And the second one is a follow-on from other people's points there, and it's really about, where will the oversight, sort of scrutiny, accountability role lie? Will it be a criminal justice? Will it be an RQIA? How will that be performed? And the third aspect is, how have you reflected on the aspirations laid down in the UN Convention on the Rights of the Child in terms of how this facility going forward will be human rights compliant? Thank you.
Thank you, Paula.
Paula, I think I've tried to make it clear that certainly families will be part of the process of developing and implementing the new arrangements, but in terms of how they maintain relationships with children and young people who are actually admitted to the campus. I mean, if I'm honest, this did come up as an issue in the course of consultation, and there were some concerns expressed about the location of the campus in Bangor. It was seen to be not terribly accessible, and in response to those concerns, I think we've given a commitment to ensuring that families are supported as best as we can, to have contact and maintain contact with their children while they are in the Secure Care Centre. The detail of that, Paula, will need to be worked through.
Could I maybe come in on that just to finish? In terms of Woodlands, we have family accommodation in Woodlands already, and pre-pandemic we facilitated family visits, particularly for parents who live quite far away and that they've brought younger siblings, and we have fairly good facilities. We've a swimming pool and so on. So we would make sure there's time for families to eat together. There's a space where they can prepare meals. There's the swimming pool and so on. So there are facilities there that are used for that, Paula, already at Woodlands. So there's a model of practice that might be drawn upon for the new centre as well.
Paula, can I come to your second question then, which related to oversight, and you're specifically asking which inspectorate would be responsible for oversight of I think you mean the new Secure Care Centre. The proposal is for us to actually look at a joint model of inspection that wouldn't only involve the RQIA and SIGINI, but also the Education and Training Inspectorate. And I think the Justice Committee may have had a presentation from officials last week relating to how we're planning to do that, or introduce that joint inspection model for child protection purposes. So we'll look very carefully at how it is being done within child protection, and take any of the learning from that and apply it to inspection arrangements for the new Secure Care Centre. So, it isn't anticipated or intended that it will be a single inspectorate rather than rather it will be a number of inspectorates operating jointly.
Sorry, the last one around human rights compliance. Thank you.
Again, this was an issue that arose in the course of consultation, and it was specifically around compliance with Article 5 of the ECHR. We saw legal advice on that, Paula, and that legal advice pointed to case law, which concluded that there aren't compliance issues, but it all depends on the interpretation of educational supervision. So under Article 5, a child can be deprived of their liberty for educational supervision purposes. Our legal advice is that that shouldn't be narrowly interpreted as classroom type activities, but rather extend to the, certainly in a care context, extend to the full range of activities undertaken by an authority in the exercise of their statutory duties relating to the protection of children. That said, I think the detail about what we offer to children and young people when they are in the secure care centre is important, and I think it's only when people see that level of detail that their confidence, I suppose, in compliance with Article 5 will be increased or will take place.
Thank you. Sorry, Chair, I should have said I have to leave the meeting at 2 o'clock to go to the Bill of Rights Committee.
Yes, thank you, Paula. That's all your questions then, okay?
Yes, thank you.
Thank you. Rachel. Hello. Rachel O's there. No, she's not online now. Peter.
Thank you. I'll take advantage of it. I should say, I almost sort of inclined probably make, in terms of what Paula had said, I mean, I suppose, as somebody who's a native of Bangor, I suppose I could say it's as far from Bangor to Belfast as it is from Belfast to Bangor in terms of people travelling. But I suppose just to follow up on a couple of points on it, and I appreciate maybe some of this will be sketched in. Mention's obviously been made about the multidisciplinary approach. So I wonder if just a little bit more, whether it's still being developed, about how the full educational opportunities will be made available to those within the new complex, and particularly how we can ensure a focus on education. I agree, I think, probably with remarks, I think that maybe Linda made earlier on, I think that maybe underlines as well the advantage of early interventions in terms of education to try to prevent various situations. But I wonder, first of all, if you could just outline a little bit more detail in terms of the broader sort of planning that is there in terms of educational provision for the young people.
Thank you, Peter. I suppose the first thing that I want to say is that both the Department of Education and the Education Authority are very much part of the plans to establish the campus. So both are represented on the programme board. In terms of what education provision will look like in the future under new secure care arrangement, that detail still needs to be worked through. We do know that we've got two systems of schooling across both sites. Within Lakewood, the school operates as a special school. Within Woodlands, it operates as EOTAS provision. So there is a task or a job of work to be done to reconcile those two types of schooling within the new secure care centre in the future, and I've said that detail still needs to be worked through. But in terms of your point about early intervention and prevention too, we've made it clear that this just isn't about what we do in Bangor, if I can describe it very loosely in those terms. It's also about what goes on outside of the secure care centre and around the secure care centre within the community, and clearly education and provision, youth provision within the community will be critical if we're going to meet one of our aims for this campus, which is about keeping children and young people out of a secure care centre in the first place.
Yeah, second point, just a final point I want to raise. Obviously, you've mentioned in terms of the secure care provision that if you like, the blueprint for that, or at least in terms of where you'd envisage that, has been at least either delayed or disrupted by COVID in terms of what can be provided during that. I wonder, just in light of that and in the broader sense, if you could outline in terms of from the implementation point of view, I appreciate we've completed the consultation stage on it, as to, roughly speaking, what you see as the ballpark timeframes for implementation, and also what you see as the next steps that you'll need to take to establish the sort of the combined unit.
Okay, so our original timescales were establishment by March 2022. I've explained that we lost 9 months by way of the pandemic, so our target timescale is now December 2022. Linda has already made reference to the need for legislation, and it will not be until the next legislative term that we will actually be able to bring legislation forward to support the implementation of the new arrangements. So in terms of the delivery of the legislation, that may be beyond December 2022. All of that said, I think there are a number of things that we can do in advance and are planning to do in advance of that December 2022 deadline. So, for example, we will put in place a new head of operations, and that individual, a senior individual, will be responsible for the running of the two facilities until such times as they become one, and we aim to do that as quickly as possible. We have already put funding in place to establish a clinical lead within Lakewood, who will be responsible for the running of what we're calling a multidisciplinary team made up of mental health professionals, allied health professionals, and specialist therapeutic professionals. We can get that clinical lead in place reasonably quickly. I've talked about the framework for integrated therapeutic care. Work has already started on the development of that framework, and implementation arrangements have already been put in place, and the proposal is to start implementation within children's residential care, where the framework will also apply in summer of this year. I think we can move to get the on-site step-down provision in place in that time, standards in place, operational procedures in place, beginning to look at education provision and the reconciliation of those two types of schooling. And I think we can also recruit permanently to the chair of the multi-agency panel. We've got a temporary chair in place for pilot purposes only, so that post can be made permanent, and we have secured the funding to do a number of those things.
Could I just ask finally, just in relation to that, in terms of the interrelationship with the legislation, and obviously you've outlined a range of steps there in terms of implementation. Is the legislation ultimately required simply to provide an underpinning and a regularisation, i.e. if, for instance, there was a particular deadline that was either slightly missed or slightly elongated, can that effectively almost retrospectively tidy up the underpinning? Or is it simply a question of there's a range of preparatory steps that can be done, but until the legislation is actually through, that the start button in terms of everything being fully there couldn't be done until the legislation is through?
sorry if I didn't make that clear. I do think that a number of these things can be done in advance of the legislation being put in place. You know, clearly we've got a legislative entity at the minute called the Juvenile Justice Centre, and Lakewood operates as a children's home. That all needs to be undone to enable the establishment of the new secure care centre. But I don't want to create the impression that until that legislation is in place
maybe to be fair,
nothing.
maybe I didn't just make things clear and try my question. I appreciate there's a range of things that can be done. I suppose what I'm trying to establish is the legislation will provide a level of underpinning, which clearly is something that would be a good and a virtuous thing. You know, what I'm saying is can everything be done before the legislation's through, or will there, if you like, it be having to sort of hang back for the final step or two until that legislation is through? We're just trying to work out the sequencing in terms of that. Obviously, you know, I think we would all hope that in terms of legislation, that if that can move in parallel so that it is there by Christmas 2022, but I'm just wondering if for whatever reason there's any level of slippage or things don't go through to say the first half of 2023, does that actually prevent everything being in place and it just being a question of as much prepared as thing, or is it something can effectively be more or less the legislation can act as a sort of retrospective tidy up from a legal point of view?
I suppose if I can summarise it in this way, until we've got that legislation in place, children from the justice system can only be admitted to Woodlands as a juvenile justice centre, and children from the care world can only be admitted to Lakewood as a secure care centre. Until the legislation is in place, you know, that admission to that single thing, that single entity known as a secure care centre cannot happen.
Okay, that's very useful, thanks.
Thank you. Members, can I just check before we lose members of the Health Committee in relation to quorum, that members are happy to agree that myself and Colin approve the draft minutes of this meeting so that there's no need for a further meeting. If I can just get your approval for that so that we don't lose. Agreed? Happy to do that?
Agreed.
No dissent? Thank you. Rachel, apologies. I think maybe we lost you there, but I think you're...
Yeah, sorry, Chair.
You're okay.
I've been having some issues with the internet here, so apologies, I definitely just cut out. So apologies as well as my questions have already been asked. Peter touched upon about final proposals and legislation, so I'll not go into that, but I do want to ask about budget. I know that you'd said about funding had been found for sort of this financial year, and I'm aware that that's coming from the Department of Health, a figure of 748,000 to cover the framework for integrated care and also then the clinical need or clinical lead. Can I ask then how much has been put in from the Department of Justice and where that is going to in this next financial year, and also just on the wider kind of proposals here, how much has been budgeted between the two departments for this, and has a cost analysis been done? How much money do both departments seek to spend or save in relation to this? And I know just about funding as an issue and about costs, the NIAO report in 2017 recommended the need to identify and apportion costs on different services, especially in youth justice. So has this been incorporated into this proposal?
Okay, Rachel, that's probably for me then. So the programme team is jointly funded and the Department of Justice is putting £225,000 into that programme team. Health is putting the same. The other issues that you mentioned are the statutory responsibility of the Department of Health, so therefore they're being funded by the Department of Health. In terms of the business case for the new campus, that is a work in progress and will need to be further developed. Currently, we are spending something in the order of about £8 to £8.5 million for Woodlands, and between 5 and 5.5 for Lakewood. One of the main aims, as the consultation said, is to make better use of that money. So the business case will be working from the basis of how do we make best use of that money. If there are specific additional things that we may need, we may, for example, need to spend some additional money to then, for particular things, we'll need to make business cases and bids for those. But at this stage, our aim is to make the best use of the money that is already spent on that footprint, rather than consider significant amounts of new money.
Rachel, if I can come in behind Stephen there, just to give you a concrete example. So the multidisciplinary team that I referred to already, made up of the clinical lead plus other health professionals. We've costed that team at around £500,000, but we've also looked at investment in other health professionals already across both sites, and one cancels the other out, so it may be using, as Stephen said, money very differently from how we are currently using it, so it will not all be about new money at all.
Okay, thank you for those answers. Chair, if I may, I have another couple of questions. I appreciate I have quite a number of questions on this, so you may hear from me after this. I don't want to hog up the entire time today. But I and others have particular concerns in relation to the development of community services and the satellite provision and the community-based provision. Not that I have any objections to it at all, but these services don't exist and they're not there yet, and they're certainly not at a capacity to be able to deal with any changes in the way that it is. We know the issues with CAMS, and we know the issues with access to mental health support already. So without sort of further investment in that and prioritisation of those community services, I see a bit of an issue in how children and young people are going to be reintegrated into their various communities. And I know that there's a bit of work being undertaken to map the services that are already in existence, the statutory, voluntary and community sector provision, and to look at how they can be coordinated. So I'm just wondering if you have an update on the community service development, and is that kind of work going to be commissioned first in this phased approach, or is that something that you're envisioning happening after December 22?
So if I can take your final question, I suppose, first. So it will happen in parallel with the establishment of the secure care centre. You have referred, Rachel, to the mapping work that has been undertaken, and what we were trying to establish by way of that mapping work was, how much community provision do we have in place currently? What services are there to support children with these levels of vulnerability who are at risk of admission to either care or secure care or juvenile justice? I think it's fair to say that it's actually quite a crowded landscape at the minute. A fairly complex landscape of provision. That doesn't mean that all children's needs are being met as effectively as they should be. So there is a further piece of work to be done following the mapping exercise that has been conducted to look at how effective that provision is, and importantly to identify any gaps in provision. But I think there's also something else that needs to be done, and that's identifying or establishing a mechanism that effectively coordinates provision around individual children. And I'm likening it to family support hubs, for example. So at that lower level of need, we have arrangements in place that wrap services around families. This is about having a mechanism to coordinate and wrap services around children with higher levels of need. I hope that addresses the questions that you have. Stephen,
yeah, maybe just add a little bit, Rachel. I mean, I think, as I said, there are a lot of services there. one of the issues is the connection between them, so the pathways between services and the navigation. And there's some really good work being done at a local level. Obviously, I'm aware that from a youth justice angle, but I know in local areas we're working very closely with social services, with education and welfare, with youth services, with the police and with other services to connect young people into the services that they need to stop them entering the formal justice system, to support them when they are in the formal justice system, or to support them to reintegrate back into the community. And some of this is about looking at this through a different lens. So I used the example in response to the Chair's question on the co-funded CAMS worker that we've got in the southern area. And I mean, the impact of that, so that's youth justice putting a little bit of money in, the trust putting a little bit of money in, and having a service that is much more tailored to the needs of vulnerable young people. So we've gone from a previous situation where young people were disengaged from the services, so 60% of people under the old regime in the southern area disengaged from the service before they actually run its course, with only 14% achieving the aim that they agreed at the start. With the co-funded worker, 88% of referrals are now completing the course with the aim achieved, and only 12% disengagement. So just by a little bit of money, doing things a little bit differently, we're achieving a really significantly better outcome for young people. So it's about those kinds of things, and it's doing that more and creating those pathways and those partnerships.
Thank you for that answer. In terms of, we would discuss there about sort of the varying needs. And I'm aware just with the day-to-day operation of this campus obviously hasn't been worked out fully yet. I think there's quite a bit of work to be done on this and information to be done. But how will mixing of children and young people with varying care needs and varying staff teams then too, I suppose, be managed along the lines of, say, someone who's at risk and in the campus under the Article 44, and then someone who's there under PACE for burglary or attempted robbery, say, and without having the secure accommodation for those who have got serious at-risk behaviours or very seriously unwell, is it still going to be treated out of Northern Ireland? Is it because we don't have the secure accommodation then elsewhere? So I suppose, is there any detail on the day-to-day operation of how those types of cases would be managed?
I take that, Rachel, and the question was partly asked by others before you. So the proposal is that any child who is admitted to the new secure care centre, their needs will be fully assessed. Any risks that they either pose or are potentially risks to which they are exposed will be addressed as part of that will be considered as part of that assessment process, and that will determine where within the secure care centre they are placed. And Stephen already described some of how that happens within Woodlands at the minute. Across the both sites, we'll have 9 different units where children can be placed, and the proposal under the new campus arrangements is that they will be placed in those units in smaller numbers. So maybe a 6-bedded unit will house 4 children rather than 6 in the longer term. In terms of children who we send outside of Northern Ireland, yes, we do it at the minute, and part of what this campus is intending to achieve, I don't think it will achieve it on its own, but part of what this campus is intending to achieve is that that happens less in the cases of some children in the future. It's not all of the answer to that issue, but should address some of it.
Thank you very much. Yeah, I'll happily pick up with that. And finally, Chair, if I may, the step-down facility is proposed to be across the road. I'm just wondering for your assessment on the appropriateness of that for, say, a young person who's been in the campus, then goes to Ashcroft and then back to their community, especially if the community provision is not there to wrap around them. And I suppose then what's going to happen to those who are in Ashcroft if that's where the step-down facility ends up being?
Okay, so I take that if I can. The facility is actually Oaklands, which is on the on that Bangor footprint, and I think it's accepted that for some children and young people, a rapid move or a rapid exit from a secure environment back into the community isn't always best for them. So for those children, that is the purpose of the step-down facility, to enable them to be gradually reintroduced or reintegrated back into the community. We've already made the point that the success of this programme relies to a large extent on service provision within the community. So you're quite right. We need to do that better than we're currently doing it, and I think Stephen has identified what part of the problem is, and that is about services working better together, and there being very clear processes and pathways between services that currently exist. So there's a whole combination of things here, Rachel, that need to fall into place to make this programme realisable and the success of this programme realisable.
Thank you. Thanks, Chair.
Okay, thank you, Rachel. And there's no other members have indicated. I think Doug has indicated that his questions have been answered. Just to conclude, because obviously one of the respondents was the PSNI, and do you get the sense that there is the PSNI are content with this approach? And obviously Stephen made reference to the collaboration and the working together. Are we happy that that is at a level which will ensure that the police are comfortable in the way in which they will engage with this facility?
Yeah, I mean, I think, Chair, the police are, PSNI have really good relationships, not just with the Youth Justice Agency, but also with the programme. And Joan, correct me if I'm wrong, they're represented on the programme board, Chair. So absolutely, and you know, the police are absolutely fundamental in terms of the work that we do and will be to the campus, particularly in terms of some of the things that Eilish mentioned around earlier intervention. So we do a lot of work with the police around identifying vulnerable young people who are on the margins or already sort of in the fringes of the justice system at an early stage. So there are a number of pieces of work that we already do with the police, and we're building on those relationships to make sure that the new campus works effectively and that those relationships are maintained in an appropriate way.
Okay. Thank you very much, Eilish. Joan, you got an easy time today, but we'll maybe bring you back for another session at some stage. But thank you for and listen, Stephen, again, good to see you, and thank you for all your work, and much appreciated. Thank you very much. Thank you.
Thank you. Thank you very much.
Okay, members, just to bring this to a close so that we can get maybe a comfort break before we start the Justice Committee. I think that has given us an opportunity to cover the issues. However, following on from Rachel's comments, and probably the same in relation to some members of the Health Committee, I think it would be good if both committees were able to garner what other questions they may have, and then they could be forwarded to the departments so that we can make sure we've covered this, and if necessary, at some stage, maybe before the end of this mandate, that we do this again so that we can have an overview, an update as to what further progress has been made. Would members be content if we decided to take that as an approach?
Agreed.
Agreed? Okay.
Is that a committee meeting?
Okay, I think that's maybe somebody trying to join us. Okay, well then, if that is the case, then that really brings us to a conclusion. And can I thank the members of the Health Committee for joining us, and also the members of the Justice Committee. And obviously this is a project that we'll want to keep a particular eye on as we move forward. But thank you for your time today. Unless there's any member, let me just check to make sure that I haven't missed anybody. Is there anybody has any comment that they want to make? I see Rachel smiling, and it always worries me because she probably has about a few questions to ask. But maybe I have covered that, Rachel, have I?
Don't tempt fate.
You have indeed, don't worry, I'll pile them all up and send them over to you.
Okay. Okay, if we're content then, members, Colin, thank you for your participation today, and your colleagues in the Health Committee, and we'll bring this session to a close. Okay, thank you.
Is the Northern Ireland Assembly Committee Room 30. This is the Northern Ireland Assembly Committee Room 30.